As hypnotherapists, we're dealing with neuroses, and a neurosis is a mild form of a mental problem, health problem. So it's certainly nothing to do with psychoses at all. It's usually maybe a mild depression, some anxieties or compulsions. If we think of Gil Boyne, a famous hypnotherapist in America in the last century and to a great extent in this country too, he said that most people's problems were I'm not good enough, I fear failure, and I'm unlovable. So maybe it's all of those things with some people, but maybe it's just one of those things that people can pick up on and think, yeah, I don't feel good enough. When you think about it, we're comparing ourselves all the time. We're slightly self-obsessed, and you could say self-obsession is one of the things that clients bring into our therapy room. Now, on a scale of 10, whether that self-obsession was a number 10 or whether it was just a 1 or 2, that they maybe thought about themselves sometimes, but generally not all of the time. But for those people who have a neurosis by coming in and saying, I have a lack of belief in myself, or I lack confidence, or I'm constantly comparing myself with others, then certainly they have got a self-obsession. They are busy thinking about themselves. They may think about their needs rather than other people's needs. So it's always, I need this or I need that, rather than whether other people have a need and whether they can fulfill that need too. Of course, we have this self-obsession. Just before I came in front of the camera, of course, I'm going to look in the mirror to make sure if I think my hair is okay and if my makeup's all right, because I know that people will be looking at this film. And so maybe I'm satisfying myself that that's good enough for me. So whether it's good enough for others, it doesn't really matter. But those kind of people with a self-obsession, they will be constantly thinking about how other people view them, and therefore they're not satisfied with themselves. And so therefore they can't really say, I'm okay at this moment in time. So our job is to find that neuroses that they have. Maybe it's just one thing that they present with, any kind of behavioural patterns. But of course, a neurosis as well is that they admit to having this kind of problem, which is a different kind of mental illness to psychotic illness, where often people with psychotic problems won't admit that they've got any part in it, or perhaps even blame everybody else for the way that they behave too. So our job in some way is to help them and maybe even make them believe that they are good enough, and whatever they do, that maybe they'll go through life and people will still judge and compare them, but they must be satisfied with themselves and they must really approve of themselves. So those kind of techniques that we can use in NLP, they're really helpful and useful. And yet the most important thing is that talking therapy that we do with them and listening to their language and finding out the things that they say that we can challenge and help them to overcome their own obsessions. So only yesterday somebody said that they were going through a depression, and they'd said to their wife that they needed a cuddle, they needed a hug, without thinking that their wife has probably gone through a kind of depression herself, watching her husband go downhill. But it was all about what he needed and what he wanted, rather than what she might have needed herself. So to offer some help and care for someone else, it means that we've stopped becoming obsessed about ourselves and we're starting to think about others. So although it might sound like a criticism if we talk about self-obsession, and of course we wouldn't say to a client, well, you're completely self-obsessed, unless of course they mentioned it themselves. But it is, they're thinking about themselves. One of those more serious neuroses and self-obsessions is a health anxiety, and it's prevalent in this day and age that people are really worried about their health, and it becomes more and more of an obsession about them. So any odd little ache or pain or something that's not what they perceive as completely normal in their head, then they're rushing off to either see a doctor or a specialist. And so no wonder doctors often say that 80% of the patients that they see are the worried well, which means there's nothing organically wrong with them physically at all. It's just that in their mind, they are obsessed about some kind of health anxiety. And being a hypnotherapist, we can use those hypnotic techniques to enable clients to maybe trace back and connect back to times when they felt anxious about their health. Maybe a parent was ill, maybe somebody died, maybe even a pet died, and they started to worry about their own health and about their own mortality as well. And overcoming those fears and thoughts from the past and experiences and changing perceptions. So, a neuroses is about stopping to change a perception. Change a perception as in, I look in the mirror and you know what? I look good enough. I'm clean, I'm tidy. Whether or not people approve of me, it's not really my business. I can't force them to like me. I can't force them into any other opinion except of their own. But actually, I'm okay. It's all right. Almost like I'll do at this moment in time. Of course, it's nice if sometimes we can really approve of ourselves and tell ourselves that we're really good and we've excelled at things, because it gives us that wonderful boost inside our mind. So when we're working with a neurosis and a neurotic kind of behaviour, we can really begin to think about how this person has acquired this kind of behaviour, how they've learned to behave in that way. They don't just wake up one morning and think, I'm worried about people judging me, or I'm worried about my health. It's usually anxieties are in that deeper structure that fortunately this kind of therapy that we can use really helps.